Hi, I'm Dr. Lokesh. I'm heading the Emergency and Coronary Care Unit in Frontier Lifeline Hospital. The first problem is identification. A lot of people miss minor subtle symptoms that can be treated earlier and the outcomes will be much more better. So cardiac symptoms may not necessarily be severe heavy chest pain and left shoulder pain and sweating, and all these things come in the terminal phases. Usually the earliest cardiac symptoms will be mild burning sensation, a discomfort while walking a few steps. Previously you'll be able to walk around 100 meters, 200 meters comfortably. Sometimes you may not feel so well. You may just walk a few steps and you may feel slight heaviness or tightness, or you may want to sit down. So these are all early signs. From the jaw till the umbilicus, any discomfort or pain can be an early cardiac symptom. So when you're in doubt, you can always consult a physician or you can consult the nearest cardiac center. So one more thing a lot of people miss is, especially diabetics who don't have significant pain, chest pain, they may just land up. A few people, what we have seen is early symptoms they tend to ignore. They go for over-the-counter medications. They tend to treat it as gastritis. They get pan tablets or whatever it is, antacids and everything. They take it over time. And eventually, by the time they reach the hospital, they will be in so critical condition and the heart will be already fully damaged that there's only very little that can be done for complete revival. It is lack of awareness. See, in case a person is having a burning sensation in the chest or is having in the upper abdomen, he tends to go towards gastritis. What people should understand is, gastritis, it's okay if it is finally diagnosed as gastritis, it's well and good. It's not going to kill you. But the problem is, if you are missing a cardiac issue, the problem is very severe. So always rule out the more critical cause first, and then you can comfortably treat the other part of it. In case if it is not a cardiac issue, but it's simply a gastric issue. But first you have to rule out a cardiac issue, because if you're not ruling out a cardiac issue first, you are in a bigger problem. That's the issue. So that who will be able to do? Only experts will be able to do that. So self-treatment, home remedies, all these are actually more dangerous. They just prolong the time you come to the hospital. So earliest you come to the hospital, you get your doubt cleared, or if any intervention has to be done or any issues are there with your heart, you find out newly. You get treated at the earliest, it's always the better. You get the outcomes are much more better. See, usually there are two categories of people, but now that category is getting very narrow. When a person with diabetes or hypertension over a period of 5 to 10 years, he's developing this kind of a cardiac discomfort or some chest burning, we tend to give more weightage to the symptom. But off late, what we are seeing is even 25, 26, 27, 30, because of the lifestyle changes and everything, especially men in that age group. Of course, women will also be there, but men in that age group tend to having more cardiac risk off late, what we are seeing. So the age gap is getting narrow and narrow. So there's no specific thing like only youngsters may not be at risk and only the elderly are at risk. It's nothing like that. Usually what we are seeing off late is the elderly people with cardiac arrest, with cardiac issues the body tends to accommodate over a period of time, but still they are at very high risk. Young people, they suddenly develop a cardiac issue or a heart attack. The heart is very nascent and it's like a sudden blow to the heart. So what happens is they tend to have much more severe symptoms immediately. So it is always better to get checked or better to visit a nearest cardiac center in case when in doubt. So I will tell you a small story of what happened when I saw, as a clinician, when I was during my student period. There was one patient where he was around 19 years. So he was around 19 years and then he came with a history of chest discomfort. So what history he was giving us, I'm just 19 years, sir. I just have the chest discomfort. Just give me some injection to just relieve the chest discomfort. He told he had some alcohol yesterday or something like that. But we took an ECG. So ECG was eventually normal. But what we did is we told him cardiac evaluation is a must, because we will be in the emergency. We will know what is the trend of patients who are coming to the hospital, what are the trend of symptoms. So normal ECG does not rule out a cardiac issue at all. So normal ECG, they may be in an evolving heart condition or a heart attack. Usually the initial phases of ECG will be normal. There will be only subtle changes. We need to repeat the ECGs or we need to do a troponin. There are enzymes, cardiac enzymes that will reflect. And initially the cardiac enzymes also don't reflect immediately. What happens is the heart produces certain chemicals when in stress. That may be detected in the bloodstream only after 6 hours. So before that you check and you say it's normal, it is not absolutely normal. The patient will come back immediately. So what happened, he was actually had financial issues, so he was a student and everything. So he was not willing for further evaluation whatsoever. It is, sir, it is only gas, sir, you just give me and I want to go. So we sent him at leave against medical advice. So what happened is the same student came in the evening around 3:30 or 4 o'clock, brought dead. So this is not to fear you, but this is a true incident that happened. So what happens is, this is maybe the severity, especially in young patients. See, there is a difference between panic and understanding what is the issue. So what happens is, nowadays, even young people, because we are, out of 10 people, 1 or 2 may have cardiac issue. So our 8 may not have cardiac issue. Like I told you, but the 1 or 2 we miss, they will land up in grave conditions. So we are in a position that out of 10 people, we have to screen 10 of them. So because we have to catch that 2, that may eventually lead to a life loss or worsening cardiac condition. So that is a thing. That's why never take a cardiac condition or symptom very lightly. There are a lot of tests to predict how bad is your, based on your family history, your blood cholesterol levels, and your level of activities, and other blood tests, supportive blood tests or scans. Based on that, we have a lot of modalities to tell you what will be your approximate cardiac risk. So that you will be getting evaluated only at a cardiac center or a cardiologist. So when in doubt, always it's better to consult a cardiologist whenever you're having doubt. Recognition of symptoms is one of the dangerous parts. Usually, like I told you in previous answer, usually people tend to take that heart burning sensation or whatever it is as a very minor issue. Just they try to take some home remedies and try to delay the time coming into the hospital. So see, first time when you do the evaluation, you will have an approximate idea how your basic overlying cardiac health is. So further down, if you're having repeated symptoms or not, you will be in a position to judge whether you're truly at risk or not, because your cardiologist will be following up with you and everything. So one of the most dangerous things is, one thing is delaying the onset coming to the hospital and not recognizing the symptom to be a cardiac symptom. Probably there's a risk of being at a cardiac symptom and coming to the hospital, delaying transport to the hospital. That is one thing. And one more thing what I see is, usually if there's any patient with a cardiac issue, or they are, okay, for example, you're taking an elderly person with a background history of diabetes and he's having a chest pain. So common at generally people tend to assume it's probably a heart attack because he's having a lot of risk factors and everything. He's sweating, he's having breathing difficulty and all those things. So usually people tend to panic, and first thing what they do is they try to give some water to him, or they try to make a crowd or people crowding around him trying to do something to him. And then one more thing, trying to transport in their own vehicle. The problem what happens over here is, first thing, when you're giving water to a patient who's already under cardiac stress, or we don't know whether he's having pulmonary edema, the condition where the water build up in your lungs. So the patient will be very irritable and all these symptoms will be there. So irritable and breathless and everything. At this point, when you give water, what will happen? There is a high chance of the water going into the lungs rather than the intestine or stomach. So what happens is, this actually will worsen the condition. That is one thing. And one more thing, when you are in doubt, when you think it's probably your near and dear one, somebody is having a heart attack, probably you feel it's more like in favor of cardiac attack by whatever knowledge you're having or whatever you're looking into, always call for help. Call for help is number one, call the ambulance. Now, why ambulance? What happens is, once you call for help and ambulance, after that you take care of whatever you want, give some space around the patient. Let him lie. Don't try to make him lie flat or make him sit up. Keep him in a semi-recumbent position, around 30 degrees. Try to give us light headrest, and then give him some space to ventilate. Don't crowd or overcrowd around him. Don't try to give him anything orally. Just make him calm. You be calm. And first thing, you call the ambulance. What happens by this time is, when you are calling the ambulance first and then taking care of the patient, the help will be arriving by the time you manage the patient. Okay. So once the help arrives, the treatment starts at the home. So in case of a lot of cardiac conditions, in case the patient goes into cardiac arrest, we need to give shock. Or in case the person is having a heart attack, ECG is saying, we'll do the ECG at the home itself. So in case the person is having a heart attack, it will reflect in the ECG immediately. So what will happen is, then we can give the medications as early as in the home. So the chances of survival is much better, because we are trying to open up the arteries as early. We are giving all the preliminary medications at the earlier time. So by the time they come into the hospital, we can keep everything ready, including the cath lab for all emergency procedures, and the hospital will be ready. So your treatment will start from the home, in the ambulance and the hospital. In case the patient having a heart attack is going into cardiac arrest, that the heart is suddenly stopping, taking care of CPR and everything will be done by trained professionals. So one thing what we should do is, basic understanding of cardiopulmonary resuscitation should be there as a basic knowledge for everybody. So that is how it is.